Hi, I'm Christy Johnson, and I am a hand surgeon at Orthopedic and Spine in the Rockies. I'm a native of Colorado and have come back, and I've been at OCR for about 5 years. I'm going to talk to you today about one of my favorite things, which is wrist fractures. This is an example of a distal radius fracture. This occurred in an elderly woman, and what you can notice from the x ray is shortening of the radius here relative to the ulna, and that the hand bones are falling backward with the fracture fragment. In this woman, she is a postmenopausal female, and this is an indicator of osteoporosis. And for this reason, I'm recommending that we get a bone density scan to further assess her risk factors for additional fractures, including that of a hip or spine fracture. This is one of the most common fractures we see and treat. They can happen in young people as well as elderly people with osteoporosis. This is oftentimes a surgically managed injury, but oftentimes not as well. Another example of a fracture is the scaphoid fracture. This is another type of fracture which can occur in both young and old patients. This one occurred in a 19-year-old female who fell while on a skateboard. This is a commonly missed fracture, and oftentimes if people go to an urgent care, they'll be told that x-rays are negative. Unfortunately, this bone does not heal as reliably as other bones in the body due to a diminished vascular supply. And if you're having persistent pain after a presumed diagnosis of a wrist sprain, it is extraordinarily important to come and seek medical attention. Specifically, this fracture is noted by tenderness here at the base of the thumb, and radiographs can show a very subtle fracture right here, very hard to see, but is diagnostic of a scaphoid fracture. If not treated properly, including prompt recognition and casting, this can lead to devastating outcomes, including arthritis at a very early age. Thank you so much for taking the time to listen to me. If you have any questions, please feel free to leave comments, and I'd look forward to getting back to you.